So Fiona is a child nutritionist. She's going to be sharing how that has been for her as a person. And of course, teaching us on the right time to introduce your kid to solid foods, what you need to introduce at that particular point, and what to do if that food is actually not working for your kid. So Fiona, karibu sana kwenye show.
Thank you.
It's an
Thank
honor.
you. Thank you so much. My name is Fiona. I am a certified child nutritionist. I run a page, Instagram, Motherhood and Food. TikTok, the same, Motherhood and Food. Facebook, Motherhood and Food. And also I have a Facebook group, Cooking, Baby Food and Snacks Info, Winning Info, Kenya. So we are going to discuss basically when you start weaning. Weaning is basically the introduction of food when at 6 months. So the whole recommendation is we start weaning at 6 months. So if your baby is below 6 months, the ideal person to tell you now you should start weaning is a pediatrician.
Okay.
Because there are guidelines where there are things your baby should have attained before you start to offer them solids.
Mm-hmm.
So if you start below 6 months, we have an issue because breast milk or formula is still their main source of nutrition. But we understand we have cases where breast milk is not available, formula is not available. So the best person to guide you on that is a pediatrician based on your baby's current progress as they are growing.
Okay.
So for me, I'm going to talk about when you start weaning for at 6 months, the recommended age. 6 months means 180 days after birth. Exactly. So before you start weaning, there are things your baby should have attained. For example, proper head control.
Mm-hmm.
This is very important to prevent choking. You see, you can't start weaning a baby who can stay like this.
Okay.
They can't hold their head up. They can't sit at least a few minutes without the support, because now the airway will not be open for them to feed well. So we need a baby who can be able to hold their head and also their neck. Then we also need a situation where a baby can bring a toy from the ground up to the mouth. So hand and mouth coordination.
Okay.
That way, because we have different forms of weaning. I'll come to that later. And then we also need to understand the curiosity.
Mm-hmm.
Your baby shows signs. When you are eating, they are eager to see. I want to. But remember, baby can show they want to eat below 6 months. That does not mean a baby should be weaned, because their digestive system is not yet ready to tackle solid food. So when you say your baby is crying for your spoon when you are eating, that is not a sign you should start weaning. That is perfectly normal. It is curiosity, and we encourage it. But that does not mean you should offer your baby food. So you wait until when they get to 6 months, or when you go to your clinic visit, you take the vitamin A and your doctor tells you now it's time to start solid food. So I guess that we have shown the signs where you need, so the baby starts to weaning. Let's go to what can I offer, or let's go to different types of weaning.
Before we go to different types of weaning, you've talked about your child being able to have head balance.
Yes.
How do I achieve that with a newborn?
You see, that is a milestone.
Mm-hmm.
A baby being able to sit up, that is a milestone. We have babies where they sit fully without support at 9 months, but these babies can sit for a certain amount of time without flopping back.
Okay.
You see, you don't want to feed a baby who is going like, they can't hold their head. Yeah. You imagine giving a baby a spoon, then they are like, the airway will not be open. So we need babies who can be able to hold at least their head for a few minutes.
Okay.
So now let's talk. There are different methods of weaning. We have the traditional way of weaning, where we start from blending, then we mash, and then to family foods. And then we have the baby-led weaning, where we start from whole foods immediately from 6 months.
Okay.
They are not taking any blended, they are not taking any mashed food, they are going directly to whole foods. And then we have the where you start with accelerated weaning, where you start with, let's say, mash or blended, and then in 7 months you dive into whole foods.
Okay.
So we have discussed the 3 ways of weaning.
Yeah. So
now let's discuss the traditional way of weaning. traditional way of weaning means you are blending or mashing.
Okay.
So let's say your baby is at 6 months. Ideally, this is the common way of weaning babies when it comes to feeding them solids. Remember, solid at 6 months is complementary. It does not mean that your baby is now source of nutrition is solid food. No. Breast milk or formula still their main source of nutrition. You are teaching the baby, now we have banana, we have carrots, we have rice. But that does not mean you start weaning 3 meals a day or plus snacks. No, it means gently, complementary. So you are still breastfeeding, you are still offering formula while they are learning to eat the solid food.
Okay.
So when you're starting to blend the traditional way, we have progression of or transition of different texture. When you blend for so long, your baby struggle to handle the mashed food. And you mash for so long, your baby struggle to handle the family foods.
Okay.
So when you are blending food, ideally the guideline, blend food. If you start with blended, remember a 6-month baby can take blended or mashed.
Yeah.
So this is a personal choice or a method that works for your family and your baby, depending on the current situation your family is in. So when you start to blend food at 6 months, at 7 months, try to mash. Now you change the texture. Because if you stay for too long blending, the baby won't learn to take unblended food.
Okay.
So at 7 months, you start mashing. At 8 months, you start chunky mashing. Chunky mashing means you leave small bits of food into the mashed food. So in this case, you can use a fork to leave at least, a fork won't mash that finely if you just press on the food while you are mashing. And then now at around 9-10 months or so, your baby now transitions to the family foods.
Okay.
Family food, this means finger food. The food should be soft so that the baby can start chewing. We have a myth that baby to take family food, they need to have teeth. Teeth that are necessary. The gums are strong enough to chew. Remember how when you are breastfeeding, they bite, or when they bite the nipple of the bottle and it starts wearing off. So their gums are strong enough. So the only way is that you offer food that you can easily press with your fingers. The baby will be able to chew on it and handle the thing. So try as much as possible you transition from one texture to the next to avoid having issue later at 1 year when your baby is still on mashed or blended food. So until there, now we have tackled traditional, the traditional way of weaning. Now we have it's not common yet here, the baby-led weaning. This is where you offer whole foods to your baby. Whole foods in this case means like, for example, a banana. A banana you peel, if she'll peel for me. So a banana you peel, and then you don't use a knife. When you use a knife to cut a banana and offer to a baby, it becomes slippery. So they can't be able to hold it. So when you peel the banana, wait a minute. Okay. So this is a banana. So at the tip here, you press it, and then you divide it into 3. How can I put? Into 3 ways, like this.
Does that come with any benefits?
Yeah.
Okay.
Go to that. So you see, when you divide the banana into 3 ways, it is not slippery.
Okay.
You see, you can still hold it. You see, it's not slippery. You can still hold it. But when you use a knife, the baby can't hold. This is why. At 6 months, the baby uses the whole palm to grasp food. So they hold food like this. And that's why we say finger food. This is a finger food. Finger food is the shape of the food. So, in general sense, how you offer finger food, it should be the shape of your 2 fingers. When you combine your 2 fingers like this, so the baby can be able to hold it together and eat and all that.
Okay.
So I hope you are getting the drift what is whole foods and offering now to baby food. So when it comes to baby-led weaning, you are not spoon feeding. You are letting the baby pick up the food, feed themselves, and eat. Remember, it's not about the amount the food the baby eats, because breast milk or formula is still their main source of nutrition. It is the exposure.
Mm-hmm.
So you find cases where babies are not eager to eat mashed or blended food. In this case, try and transition to the whole foods. If you need ideas how to serve different forms of food, you can check my Instagram page. I have reels where you can show how to serve whole foods for self-feeding, because I started self-feeding at 7 months. We didn't blend, we mashed at 6 months lately. Then at the end of 6 months, we started with the whole foods. So I did the accelerated weaning, not basically baby-led weaning, but accelerated. But now from 7 months, it was completely self-feeding.
Okay.
So that's where if you need help, I do still do consultation on baby-led weaning. You can reach out on that.
Okay.
So we have done on methods of weaning.
Yes.
Another question is, what is the right food should I start with when I start to wean? Okay. Now when it comes to this, how we were brought up or how our moms teach us is, you were brought up on malenge, potatoes,
Yeah.
and spinach for I don't know how many months. Now this one becomes a problem. Why?
Mm-hmm.
Baby needs variety. Because imagine offering a baby all everyday pumpkin, banana, spinach. Eventually they get bored. Now a baby gets to 10 months or 1 year, they don't want those food anymore. Now introducing new foods becomes a problem. So the current guidelines, we have no restrictions on the type of food.
Okay.
The only restrictions we have is when we are introducing the common allergens. The common allergens in this case, there are 9, we can say 9. They include dairy, eggs, wheat. We have soy products, fish, shellfish, sesame seeds, and I don't know if I've forgotten some. So we have shellfish, peanuts, and tree nuts. Tree nuts in this case refers to cashew nuts, almonds, such. Peanuts is the normal njugu that we take.
Mm-hmm.
So only the common allergens we guide on how to introduce. Each allergen should be introduced on their own, meaning like roughly every week on its own. Let's say you offer Monday neg.
Mm-hmm.
So for the whole that week, no other allergens, or let's say 5 days. That way you are able to observe any reaction your baby has. With babies with eczema, we have special cases where the guideline is a bit different. But now you see every week you offer new allergen. So if your baby, for the rest of the week, you observe how your baby reacts. And it can cause a reaction, let's say tummy ache, your baby is uncomfortable when they're sleeping, diarrhea, constipation, vomiting, rashes where the skin came into contact with the food, or maybe after eating just rashes all over the bubble, the baby's itchy, scratching. Now you know your baby is allergic to that food.
Mm-hmm.
So only the common allergens we have away every 5 days or a week. When it comes to the other food, these are the butternut, spinach. Before, the guideline was every new food every 3 days.
Mm-hmm.
The current guideline, that is not applicable anymore. Reason being, it makes baby bored. Imagine a baby eating butternut for 3 days that you are looking for allergies. They just see that plate with butternut and they're like, no, today I'm not doing this again. No, mama, today you are coming too much. Yeah. So what happens is you can offer new food daily. Okay. There is no restriction. Today a baby eats butternut and spinach. Tomorrow, rice and dengu. So there's no issue. Mm-hmm. Unfortunately, babies can react to anything. You just have to observe and now note down how your baby reacted after eating dengu, beans, and all that.
Okay.
So we have talked, so meaning a mother can start with vegetables, sweet potato, spinach, carrots, fruit, banana, watermelon. Mm-hmm. But remember, variety is important because breast milk and formula are naturally sweet. So if you focus so much on the sweet food, your baby may start rejecting the foods that are not so sweet. Okay. So we need variety and balance. So mix all together, mix them so that the baby can be able to taste this and that. Remember, they have acquired the taste when you are breastfeeding.
Yeah.
So all that. So have a variety so that the baby doesn't struggle in taking solids.
Okay, and is there a specified amount of food that I'm supposed to give?
There is, okay, per the guidelines is 2 to 3 spoons per teaspoons actually per feed, because breast milk is still their main source of nutrition. But now, if your baby eats more, that is a bonus. We have expectation versus reality. Most moms think my baby should finish a certain amount of food to believe that the baby has eaten. That is very wrong, because remember, the baby has breastfed before, so, and maybe the food is not that sweet to their palate, they don't want more. So forcing becomes an issue. Forcing, you create a bad relationship with food. So if the first time your baby just ate 1 spoon and the next spoon is coming with rejection, that is enough. Remember, you're still breastfeeding, you're still offering formula. So small amounts of food are enough, 2 to 3 spoons. And remember, when you're beginning to wean, 1 meal a day is enough. A maximum of 2. If you are having issue, maybe the milk supply with formula issue, but not more. You overfeed the baby, you lead to issues with constipation. Remember, the baby is used to digesting liquid diet.
Yeah.
So imagine a 6-month baby start offering 3 meals plus snacks. The system becomes overwhelming. They can't digest it. Now constipation happens. So in the beginning, 1 meal is enough.
Okay.
2 to 3 teaspoons. If they eat more, well and good, that is a bonus. If they refuse after 1 spoon, that is good too. It's a new journey. Be patient. They are warming up to eat. Yeah.
Okay. I have a curious question. We've said 6 months is the recommended age for introducing your child to solid food.
Yes.
What happens in the case whereby your child is 2 months and they're already eating? And in the case that, let's say we are past 7 months and my kid is not eating solid food.
Okay. You see, that's why I was saying, below 6 months, make sure you are talking to a pediatrician, because they are the only one who can tell you your baby is growing well or not. And that's why we have the graph and the charts and all that. A 2-month baby can't handle solid food. They are missing out on the important nutrients they need to grow. Unfortunately, we have those cases. I wouldn't like to say that you are doing wrong, because I know circumstances can lead to issues where you just there.
Yeah.
But in such a case, below 6 months, make sure you are working hand in hand with a pediatrician so that your baby is growing well and meeting their daily needs on what they need.
Okay.
Above now 6 months, at 7 months, you have said the baby is not warming up into solid.
Yeah.
Be patient. That is where now we start trying different weaning method. Maybe your baby is just not into blended food. Some babies prefer what is on your plate rather than what is on their plate. Because imagine a baby's blended food and they can see on your plate you have rice, beef, veggies, and theirs is just mashed thing or blended food on a bowl. They are like, this one is not working. So in such a case, try and transition to the next lecture. It can be mashing or it can be whole food. So you try and see what works for your baby or why your baby is not eating. So, and some babies prefer eating from their plate. That one is still fine. The only thing you eliminate below 1 year is salt.
Okay.
No salt, because salt is available on the whole foods, plus the breast milk and formulas they are eating, they get enough sodium. Also, iodine is still in food like egg and all that. So you limit, no salt below 1. You can still share a plate with your baby, just eliminate the salt, and your baby is good to go with feeding. Yeah.
Okay. We've talked about a banana. Are there other fruits that are recommended for, let's say, 6 to 1 year? And are there also fruits that you wouldn't recommend for a 6 to 1 year old?
Actually, there is no. That is the beauty of the current guideline. All the foods are way to go. The only thing we limit below 1 year is added salt. But remember, added salt does not mean your baby food should be bland. No. We have spices and herbs for that. A small pinch of cumin, turmeric, paprika goes a long way to elevating the food, elevating the taste of the food. So salt, as much as there's no salt, does not mean your baby food, you just boil and mash it and give it to your baby. Who wants that? They have been breastfeeding and they can taste a bit of garlic, a bit of ginger in your breast milk. So why are you just boiling and mashing and offering? No. So you have spices to replace now the salt. And then added sugar, we have fruits like banana, apples to add, let's say sweetening porridge, oatmeal, fruit smoothie. So you can use fruits. You can use things like dates in moderation, of course, because they have high sugar content, but at least they are not raising the blood sugar. So you have dates, raisins, fruits to add of the sugar. Other things we are not offering below 1 is processed meats like sausages, smoky.
Yeah.
They can come after 1 in moderation, but below 1 we are still not offering. Another thing is cow milk as a drink. Cow milk can be used in recipes. Not every day, of course, but in moderation. But now as a drink become an issue because too much cow milk leads to low iron levels. Low iron levels lead to issue like poor weight gain, poor appetite. So no cow milk as a drink below 1 year. In a case where you need to offer cow milk, please ensure you are talking to the nutrition to ensure your baby is growing well per the recommended weight and growth and all that. So, and also we have things like honey. Honey under no circumstances should be offered below 1 year.
Okay.
It has a toxin. It can lead to issue botulism, which can lead to floppy behavior. They don't want to breastfeed, weakness on the muscle. So no honey below 1 year. Then we have undercooked meat and eggs. Ensure the food is well cooked so that there's no bacteria and that can lead to infection and all that. So it is very important to cook baby food well and preserve it well so that there's no multiplying of bacteria and all that. So before offering the baby.
Okay.
Mhm.
I checked your profile.
Yeah.
Niliona, you also offer winning recipes.
Yes.
So maybe you can share with that.
Okay, so when you check my page, Motherhood and Food, for example, Instagram or Facebook or TikTok, for example, I have a lot of recipes. The reason why I do recipes is because most of the time parents are confused. What can I offer my baby? When you call your mom, for example, they tell, I was there, I know. When I call my mom, tell me, you just offer malenge and you mash it up and you offer your baby. But you know, when I was a picky eater. So winning for me was a daunting task. I didn't want to start that journey because I knew I was picky. So the reason why I started this journey is because it was because of me. I didn't want because you remember in our time you were beaten if you are not eating. I was that child where you are not eating, you are pinched or whipped or all that. But now, remember now, when I came to understand that there's a lot babies can eat. Anything we eat as an adult, a baby can eat, apart from now the foods we have said below 1 year should not be offered. So for example, you don't necessarily need to start boiling food. You can add onion, you can add oil from 6 months. So it doesn't have to be always boiled food. And also, your baby can eat from the same sufuria you are cooking on. Let's say you have cooked ugali, spinach, and meat. They can eat from the same pot, only that you serve their food before adding salt and spices that has high in salt below 1 year. But the rest they can eat. You just take the piece of ugali, spinach, and a bit of, if the meat is not soft, the soup of the meat, you just mix it together and offer the baby. And the baby enjoys the meat because you are eating the same meal. So literally, so babies can eat anything. So, but if you are struggling, I have meal plans, I have recipes to start. All that are from my Instagram page. It's easy to follow. Yeah.
Okay. It's true. Babies can eat anything.
Yeah.
And you've also made it clear. It's good to discover new foods each and every day. It's a good thing.
Yeah.
So you've also talked about weight. So as a mother, how do I keep check of my child's weight to avoid maybe things like malnutrition, overweight, and all that?
Now let's discuss overweight. Okay, overweight I have, like say for example, your baby is 6 months, 12 kgs. And then you think your baby should not be weaned at 6 months. No, you start weaning at 6 months.
Okay.
Because once your baby starts crawling, walking, the weight will always stabilize itself. You will find they won't add more when solid food starts to be offered. So they eventually go back to the graph and fall according to their weight and their height and all that. So if your baby is overweight, you should still wean. For babies who are born premature, you always need to work with your pediatrician. Now he or she will guide you when it's the right time to start soling. So remember, this one I am talking to a baby who was born full term, normal weight, normal everything. So this is a guideline for a baby who is just full term baby. So in special cases where we have babies born with our special child, like cerebral palsy, Down syndrome. So that's one of special cases. Always work with a nutritionist and a pediatrician to be guided well. But in general sense, our overweight baby should still be fed. One of the ways to prevent, as we have said, malnutrition is offering the required number of meals the baby needs. At 6 and 7 months, they can eat a maximum of 2 meals a day. That one is enough for them because breast milk and formula still offers their main source of calories. 8 to 12 months, they can eat 3 meals a day. Below 1, they don't need snack. And what is a snack? Below 1, everything offered is counted as a meal. Be it a fruit smoothie, that is a meal. Be it uji. That uji is not an appetizer, please. Uji is not an appetizer. So be it uji, it's a meal. Be it fruit smoothie, that is a meal. So for example, let's say a 9-month-old baby. You wake up in the morning, you offer uji for breakfast. And then you offer lunch, a banana, avocado, milk smoothie. And then for dinner, rice and dengu. Those are the 3 meals a day. Meals are not rice and dengu, chapati and beans. Those are not the only meals. Everything you offer below 1 year,
it's a meal.
It's a meal, exactly. You count it as a meal.
Got it.
Yes,
Got it.
we count it as a meal.
Yes. Speaking of meals, what shouldn't I miss on my, let's say, 6 to 1 year old's diet?
Now you see, when it comes in the beginning, saying a balanced diet can be a little bit of a tricky. Because you see, when you offer an avocado mixed with formula, that is enough for that baby. So necessarily, it's not about balancing the meals per se. At 9 months, it will come, or 8 months, it will come. But in the beginning, it's all about teaching your baby. Apart from breast milk and formula, we have carrots. A carrot puree, let's say you mix with beetroot, that is enough. You see now there's no meat, we can't say that is not a balanced meal. At that age, that is enough. So generally, you start small while you are building up and adding. Remember, meat can be offered from 6 months.
Oh, wow.
It's not about an issue that 1 year we start offering. Before the guideline was like things like eggs, we offer at 1 year because of allergy issue. The current guideline is from 6 months because the more you delay, the more there's potential allergy reaction. So from 6 months, we start offering things like eggs, peanut butter, and all that. So you start in small amounts while you're building. So porridge and I don't know what, let's keep it at, you reduce amount. We can't be taking porridge every day. It becomes the baby. You see, we have cases where the baby sees the bowl and start crying. And then you say, my baby is very fussy. When he or she just sees my bowl, starts crying. Baby just like us. When you go to a restaurant, when food is served, what is your first reaction? If the food is served well, you are eager to eat. You enjoy it. The same way when it comes to feeding our little ones. It starts with the eyes. The baby might not talk and say, Mommy, I know this is porridge, I am done. No. They can see and know this is porridge coming. Yesterday it was porridge. This is porridge. 2 weeks later, it's still porridge for breakfast. It is still porridge. No, they start crying even before you sit down. So baby eats with all their senses. Sight, touch, smell. And this is the reason why I advocate for allow messy feeding. Allow the baby to touch the food, to explore. Remember, even if you're offering blended food, it's okay to serve on the side non-blended food. If you're offering blended banana or mashed banana, it's okay to serve whole banana the way I've splitted it on the side. Let the baby touch it. Let the baby bite it. They might gag, which is normal. We'll come into gagging and choking later. But it's very important to offer variety. Because when you offer variety, you also maximize the nutrients your baby is getting. It's not the same thing over and over. And one of the ways to prevent malnutrition or issues with weight is offering variety so that the baby gets. And above all, breast milk on formula, still important until they are 1 year.
Okay.
Mhm.
Before I let you go, how do I prevent choking? And what are some of the home remedies to, let's say, if my kid chokes on food?
Okay. Now let's talk about gagging and choking. Gagging is a reflex where it occurs to prevent choking. Okay. As an adult, our gag reflex is at the back of our at the throat here.
Mhm.
For babies, it is almost here. So a baby, a gag reflex is the reason why you see when you're spoon feeding, you might push the spoon too far,
Mhm.
they gag. Or when they are full. The baby is full, but you are still insisting they eat. Now they vomit everything they had eaten. It's very important to understand your fullness cues of your baby. If they eat 3 spoons and say they start turning their head like this,
Mhm.
they don't want to eat anymore, it is a high time to say that meal session is enough. If they were actively eating for the first 10 minutes and the rest is war,
Mhm.
or you are warming up the food, imagine eating for 1 hour. 1 hour, that one now is overwhelming, even for the baby, and frustrating to even to the caregiver or the mom and the dad.
Yeah.
So it is important to notice your baby's active feeding window. If your baby is active the first 15 minutes and then they are not interested, that is enough. So when you offer gagging, a baby can choke on any form. It can be whole food, blended, mashed. That's why we insist no force feeding
Okay.
when it comes to feeding their baby. It is important they understand. Gag reflex is very important. You see, when you put food in the mouth of the baby and they push out, we call it the tongue thrust reflex.
Mhm.
In the beginning, it might be there when you put food and they just push it out.
Mhm.
Which one is normal? They outgrow it. But now gagging is the
Mm.
and the sound they make. That one is very important because it shows they are protecting now the choking, and they are also knowing they are learning. Hey, that one I put it too far. I need to bite small. I need that. So it is encouraged. So when a baby gags, don't scream. Encourage. You are doing fine. I know it is scary. I have been there. It is very scary. You put it a straight face and telling your baby it's okay. You are doing fine. Just and they vomit. Like you see in my case, when he would gag extremely, he will that will be the end of the meal session. And that one is fine because if I forced it, it will be frustrating. So you end it there if your baby is not interested to continue, and we breastfed or formula in other cases, and you offer. And so gagging is very important. Actually, we love it. When you tell me your baby gagged, it's very important. And gagging not only means the food they are eating, even the texture. Sometimes avocado to some baby is so slippery, it just tastes that way. So they might gag on the texture, and it's very normal. But remember, gagging does not mean your baby hates that food. It's just the response to the texture, to how it felt on their mouth. So gagging is encouraged. The same way I had forgotten, when you offer food, let's say spinach and carrot, for example, and your baby refuses that meal,
Mhm.
that does not mean your baby hates that meal. How can you hate something you have never tasted? It is impossible. They are just warming up to the journey. So make sure you are still rotating it in the diet so the baby gets exposure is key. If my baby refuses banana today, does not mean he or she hates it. Is tomorrow you offer banana in a different way. Can be on pancake, can be on a smoothie, it can be on uji, oatmeal. So literally is continue offering even if they refuse to eat that food.
Okay.
Unless it causes a severe allergic reaction, that one you eliminate it completely.
Okay.
Mhm.
We have a couple of comments in the comment section.
It's okay.
Yeah, guys, thank you so much for staying tuned for Island's Expressions. We have Musumba Felix anasema loving the show, tuned in from Chicago. Hi Felix, it's nice to always have you on the show. Steve Biko anasema Nyoso ni okay. Hiyo tutaongea na co-host wangu later, but thank you so much for that correction, Steve Biko. He's also saying the hangout was so informative. Nimependa for real. Thank you so much. Ambia expert anakaa fiti, nitamfollow.
Mwambie karibu. Nakwaga fiti pia kwa recipes.
Follow back. Ian Josh, thank you so much. He has a question. Anasema, can you give examples of finger foods, or you can shape any food to a finger food?
Yeah, you can shape any food to a finger food. For example, sweet potato. If you boil it till soft, you roll it up and roll it like a rod shape. You offer your baby, or you slice it and cut into strips. that is a finger food. Let's say the issue might be with rice, for example, but also rice, you can mix it with, say chicken, a bit of vegetable, you mash it up and roll it, and that is a form of a finger food. Remember, finger food is something the baby can hold on the palm. And remember, 6 months, we said they are using the whole palm. It's called the whole palm. So you need to save it in form of finger food. But at 9 months, the pincer grip has developed. They can use the thumb and their forefinger to pick up the food. So in such a time, you can cut into small shapes that are not overwhelming the baby, and they can pick it up and feed themselves. So yeah, any food they can, even ugali. Ugali is a very good food when you're starting baby led. It is soft. It dissolves in the mouth. So it is easy for the baby to eat and feed themselves. Yeah.
Okay, thank you so much for that. Steve Bacon, there's a question I asked the doctor that was in the show, and she said a nutritionist will explain. Why can't babies be given cow milk without adding water, and what quantity of water should I add?
No, as I said below, as I said before, cow milk as a drink should be offered at 1 year. The reason why we say this is because cow milk is imbalanced. It is high in protein and all the other things. So it is imbalanced. It takes longer to digest. So a baby who is taking a lot of cow milk may not feel hungry. So you can imagine how they are missing on the essential nutrients they should be eaten because they don't feel the hunger. So that is the reason why we say cow milk should be wait until above 1 year. In a case where you are advised by your pediatrician to dilute and offer, that one you follow according to the guideline. But as for me, I will tell you cow milk above
1 year.
1 year.
Okay. Steve Biko again, mini mgeto. Weaning ni nini? Munanipoteza.
Oh, weaning is the introduction of solids at 6 months. Meaning, your baby below 6 months was only taking breast milk or formula. So weaning is the introduction of things like sweet potatoes, mango, watermelon, avocado. And that is why we call it complementary feeding. It is complementing the breast milk and the formula intake. It is not their main source of nutrition yet. Yeah.
Okay. Mwangi, hi Mwangi. Thank you so much for staying tuned. And I'm Steve Biko. Okay, I'm explaining here, Steve Biko. Thank you so much for that. But I'll just read the comment. Weaning is the process of switching an infant's diet from breast milk or formula to other foods and fluids.
Yes.
But don't forget the bit that we are just supplementing it.
Yes.
It's a supplement.
Yes, it is a supplement complementing. Yes.
Complementing breast milk.
Yes.
Liz Atieno. Hi Liz, thank you so much for joining us. And I'm loving the conversations, learning so much as a new mom. How do you handle gagging, which might lead to choking, especially when offering roughly mashed food or whole meal? I think you explained that.
Yeah, we have explained that. Yes, we have said that gagging is very much, we encourage it because gagging prevents choking. Gagging helps your baby learn the amount of food they should take. It helps them, I should not put the spoon too deep if they are picking up the spoon. They learn to, so gagging is encouraged. It is very normal. Before a baby chokes, as much as we have cases where it happens, it's not that common if you're offering the shape appropriately and the food you are not forcing. The point is no force feeding because also your baby is seated. I've seen cases where we run, where you chase the baby eating. Now that one is a high risk of choking because the baby is not settled up. So one of the reasons also we encourage good feeding habits is sharing mealtime. In most cases, we find cases where babies are seated, fed first, and then the rest of the family sit to feed. That one should be discouraged because also a way of baby learn to chew is by observing you. So chewing is not automatic. That's why I find cases where consultation where my baby is 4 years, can't chew because it is not automatic. They have to be taught. So exaggerate how you are chewing. Chew with your mouth open. Make sound. Nyam, nyam. Yes. Take it in. Yeah, exaggerate how you are chewing. That is the only baby. It is fun. It is weird. But that is the only way your infant will learn to chew food. It is not automatic. So it is, you can't just expect if I serve food here, they will eat. Even babies who are not taught to chew, because we have cases where mom says, I never taught my baby to chew, but they chew. They observed. You ate. They watched you. how you are moving food from the other side of the mouth to the other side of the mouth. And they learned, when I put food in my mouth, I do and then chew. So that's where it comes from. So it is very important to sit with your baby and eat. Even when you are leaving the nanny and all that, just tell them when you are eating with the little one, sit in front of them. You can share a plate to exaggerate. Make it fun for them to learn how to chew. Yes.
Okay. Thank you so much, Fiona.
You're welcome.
Yes, and one last question as I let you leave. Liz, the same lady who has commented, some time back she asked a question on eczema, and you also mentioned it as we were talking. So maybe briefly tell us what that is and how I can take charge of that.
So, as much as eczema is related to diet, we have other external factors like dust, pollen that affect the flare up. So when it comes to introducing a food to a baby who has eczema, it is very important to keep a food journal. So that way you are able to note down how a food reacted to when you fed your baby. Okay. So things like the common allergens, you start with very small amounts at the beginning. Small amounts in this case means, for example, an egg, if you boil it, a quarter of it, you mashed it up and add it in uji or oatmeal or a certain food. It is enough to show an allergic reaction. You don't have to offer the whole egg to see like my baby's reacting to that. Things like common allergens, start small. Peanut butter, a quarter teaspoon you add and offer the baby. Remember, a baby can react to peanut butter, but may not react to tree nuts, almond butter, cashew nut butter. So it is very important to keep a food journal. And eczema, as much as we set aside the 8 common allergens I had talked about, the dairy and all that, it's very important to know a baby can react to anything. There's no, unfortunately, we can't say that if you feed your baby this, it's going to cause a reaction. So in such cases where we have babies with eczema, it is very important to keep a food journal. You are able to see how your baby reacts to it. At the same time, if it's not necessarily the food, you look for creams that suit the skin. Environmental, if it is dust, make sure you clean often. So that the baby at least can be able to be at least comfortable, because no one wants to scratch themselves all the time for 24 hours a day. So it is very important. If your baby reacts to milk, yogurt they can't take, for example, we have variety. The coconut yogurt, you offer that. If your baby can't take an egg at all, you have tried and the egg has refused, eliminate it. The baby will still get all the benefits from other source. And that is the point we say. One food alone cannot make your baby to be underweight or low in nutrition. We have a lot of foods we can offer and still meet the daily required amounts for their proper growth and development.
Okay. I've seen a couple of more questions. Ian, Josh, and Oliza, can babies be given bread with, let's say, blueband, margarine?
Yes, bread. Yes, bread babies can eat from 6 months in various form. It can be, for example, if you are doing baby-led weaning, the common one we call in Kenya toasty mayai. We have different flavors. You can check my page for toast mayais, from orange flavor, lemon. A lot of things can be offered. So you just cut them appropriately. You can even mash it and dip in something and offer. For margarine, I would keep it at a minimum because of the type of fat it consists. But peanut, ghee, butter, they are safe alternatives to offer.
Okay. Two last questions.
It's okay.
One actually. Liz and Oliza, could you illustrate how fast and the correct way of handling serious choking on baby, because babies have died as a result of choking?
Yeah, I would say it should be the best way to handle cases with choking. If we are really, the reason why I believe most parents delay introducing family foods to their baby is the fear of choking. But the best way to handle that is going for a course that helps with dealing with that. For example, Red Cross offer courses. We have pages we have also pages in Instagram that can deal. I can't remember the name of the page, but if that person DM me, I can check the page. We also have cases like Nairobi Hospital. At times they offer once in a month or so, I believe they do offer training to nannies and parents to how to deal with choking. So if that is the fear why you are not offering family food, it is very important to take a course, you and your nanny and the other family in your family hall, so that you feel safe and equipped and all that. Because if I sit here and tell you if your baby is choking, do that, sometimes you don't even remember what I said. So it is very important to go that hands-on training so that you can be comfortable when you're feeding your little one.
Okay.
Yeah.
Thank you so much. And as much as you're a certified nutritionist, Fiona, you're also a mother.
Yes.
So
yes,
what
yes.
do you love about being a mother?
Me?
Yeah.
How can I say? The new things you see your baby learning. The thing I don't love is the tantrum part. Sometimes the tantrum can be overwhelming, and I understand. By the way, never feel guilty of just taking a break and saying, you know what, today I've had enough. Your nanny or your spouse comes home and say, now this one is your problem. Please deal with it. There's nothing wrong with that, of seeking help. Whenever you feel overwhelmed, seek help. Mothers, we have an issue of saying that we can take it all. Unfortunately, we can't, because eventually you will burn out, you will break down. So it is important to seek help so that you can be able, for your mental health too, for you to be able to give the. Remember, in your baby's eyes, even if you scold them or you shout at them once in a while, you are still perfect. And that is the thing you remember. So for you to be perfect for them, your mental health should also be there. It's very important for you to be there so that you can be able to tackle your baby and all that. But the beauty I enjoy motherhood is the little smiles, is the little, when you go home and they start talking and call you mama, you feel like, I did a good job. Okay. No matter the days I felt like, what did I get myself into? Because we all know sometimes babies come planned, unplanned, and we are there and all that. So yeah, tell yourself I'm doing good. Every day you wake up, no matter how yesterday was, always say I'm doing good, and always seek help. And you see, eventually they will grow up, and yeah, this all will be memories. Now that time will be calling them and they saying that, hey, I'm not coming. And you can remember the way you stayed up at night breastfeeding and burping and you never slept. So yeah, the small things makes me happy when I just see him and he's fine. He's a him, by the way, so he's fine and all that. So I just feel good, yeah. So to me, motherhood has been a learning experience. That's how I bumped into this feeding and all that. So I can't say it's all bad. It's good and bad at the same time, but the good are good and the bad can be too bad, yeah. But one day at a time. Yes, okay. Yeah.
Where can you find you on social media?
As I said before, Motherhood and Food KE on Instagram, Motherhood and Food TikTok, and Motherhood and Food Facebook group, Cooking Baby Food and Snacks, and Winning Info Kenya. Okay. Yes, yeah.
Thank you so much for your time.
I appreciate you for having me, and this was nice, actually. My first time. Actually, if my followers from Instagram are seeing me, this is my first time. Hi. I love you too.
It was a pleasure having you for the first time.
Yeah, thank you so much. Yeah.
And thank you for the lessons.
Yeah, until next time, we can do this again. It was fun.
Yeah.
Yeah.